Hi, I'm Dr. Riel Hoxha, founder and director of the Pediatric Dental Assistants Association, and I've got some great ideas and tips for you. I know during this time you're worried about your health, your family's health, you're concerned about your team's health. Have you thought about your practice health? What is going on in your practice? Is it healthy, and what can you do to make it stronger and even more cohesive? Well, the Pediatric Dental Assistants Association is a resource for you that has lots of information and trainings that can help you during this time. So let's take risk management. When's the last time you had that discussion with your team, if ever, about what they do, say, write, any type of communication has a tremendous impact on your risk of having a claim against you or your office? Well, we have a risk management module on the PDTA website. It has 12 different parts to it, so it's very comprehensive and involves everything that you need your team to know. So this would be a great opportunity when you are not looking at taking time out of a productive day to have your team learn this very critical information. So you could assign the modules to your entire team, have them look at them. There's Q&A with each module so you can track their progress, and give them a deadline when they need to have it completed. And then you could hold a virtual staff meeting and go over it all and make sure everybody's on the same page and that you are a cohesive unit as to what you're doing in your office. Now you could hold that on something as simple as Zoom meetings, and that is a free service that I'd be glad to help anybody in your team set up. You would only have to have one account for your entire team, and everybody else can just join in without having to have their own account. So it's very simple, and I can do it. I'll be glad to help you with that. That leads me to the next subject, which is scripting. Have you looked at your scripting in your office recently? It's probably been years, and it might be a great time now to re-look at that and have your team actually go through the scripting exercise and workshop that we have on the PDTA for them to help guide them and get this accomplished for you. So you as the doctor don't even have to be involved with it. Once they come up with all the scripting, then they can bring that back to you. And again, you can look at it and then you guys can tweak it and have another staff meeting, or you just tweak it and then dispense it back out to them. That's another great example of what you can do during this time without worrying about taking away from production, since we don't have any production now. Almost all of our pediatric offices are basically just seeing emergency, and so this will be an opportunity for you to take care of some of the issues that you might have noticed in your office in the last 6 months and help with those issues. This is a great time to have your team look at sharpening some of their skills. It might be where the front desk or your admin team now can learn more about what the clinical team does, and so they're more informed, and that way they give better communication to the parents when they ask them a question about it. So say you had somebody who was having a little trouble getting bite wings that weren't overlapped. Well, they could look at the segments on the radiology and the bite wings and kind of sharpen that skill set again. How about marketing? Get them all together and brainstorm and think of some cool ideas they could do for marketing in this coming year. Here's an example of something you could do right now. Contact your patients and have them post a picture of what they're doing during this time. Whether it's homeschooling, or maybe they're doing arts and craft projects, maybe they're baking, whatever they're doing, have them submit a picture and post it on your office Facebook, and then run a contest that whoever has the most likes wins a prize that you determine. So this would help you with your marketing, because not only are you engaging your patients and their families, but they are now sending your message out to all their friends and their families. And look at cool marketing you're getting with no cost. That's just one example of something you can do right now. You want to reach out and keep your patients engaged with you, their families, their parents engaged with you, and making your team as strong as it can be, and that will help you have a healthy practice. So kind of look at this whole time as a remote retreat. Something that you might naturally go out and do at a retreat, team building and having them all work together as a unit, you can do this way and just have your meetings remotely. All of these are going to help you become stronger as a practice, healthier as a practice, and really keep your team fired up and cohesive and doing all they can to help make your practice strong. I wish there was a magic wand I could do and wave it and just make this all go away, but I don't have one. But I have 130 modules that can help you strengthen your team and get them all together as a cohesive unit and make your practice as healthy as it can be. I'm Dr. Rhea Hogseth. This is your Practice Pro from the PDTA, and I'll see you on the next one.